positivity vibes, sending them out, got a little bit of compassion, love, and then we're gonna sweep out their negativity. We're gonna sweep out the negativity, sweep it out. So
Okay, I got it. I'm ready. I'm feeling good. I'm feeling good. I might need to do that several times per day, but
yeah,
I feel like I'm ready now. I'm ready to have a conversation.
Disclaimer, it might get a little bit rowdy, but hello everyone, welcome back to the channel. I have one of my best friends here, so we always have to do the disclaimer, it might get a little bit rowdy, but we have in front of us Dr. Debbie Bradley. She is a medical oncologist and she is a physician coach. I am so excited to invite her to share her story. So we're really going to dive into how Dr. Bradley has really embraced walking in her true authentic self, because that's a topic that comes up quite a bit on once we realized we've been part of a system for so long and we feel lost. And I feel Dr. Debbie Bradley has embraced that walking with fear, and I'm excited for her to share her story. So Dr. Bradley, I'd love to hear about your story.
Well, first of all, just thank you so much for inviting me to your YouTube channel today. You know, I've heard about this channel for a long time, and I don't know if you've all watched her Instagram, but she makes all these reels. And I've been trying to figure out why I haven't been invited to be on this yet. I mean, I'm one of her best friends. And then I realized it's because I had not yet learned how to do a reel, but I'm very proud to report that I have figured out how to do a reel and I posted it. So here I am now today.
It's true. And I even put it down on this YouTube channel. And, you know, I set very high expectations for my guests. And I'm just very proud that you have surpassed that threshold and now you're here. So it's paid off.
Thank you.
Yeah,
thank you. I got a lot of work to do to really perfect it and get to your level. But, you know, I started out at that entry level and I'm going to keep working at it.
Well, we can help people to get to that level. So just so you know, they're very important dance that everyone must learn. And so just to kind of kickstart you as you practice, if you really want to be a guest on this channel, positivity vibes, sending them out, got a little bit of compassion, love, sweep out their negativity. We're going to sweep it out. Positivity vibes, compassion, sweep out the negativity, sweep it out.
So okay. I got it. I'm ready. I'm feeling good. I'm feeling good. I might need to do that several times per day, but yeah, I feel like I'm ready now. I'm ready to have a conversation.
I think I'm ready too. I'm ready too. So for people, I know some people have had the opportunity to meet you and get to know you, which all positive, great things, because you're hilarious and are really joy to be around. And I think that speaks highly to your authenticity, your compassion, and your genuine desire to be supportive of people. And for the people who haven't met you yet, can you tell us a little bit more about you?
Yes. So I am a medical oncologist. That is one thing I do. And the reason I'm pointing that out is because I've learned over the last year just how important it is to have an identity that is more than just a physician. And I feel like for so many years, that's what I was. I was a physician. And now that is something I do, but I'm much more than a physician. In medical oncology, I've worked in the academic setting all the way to private practice, and somewhere in between is where I am now. And I actually am making a transition into industry pharma, which is coming up very soon. And I'm super excited about that. I'm also an adrenaline junkie. I grew up a competitive figure skater. I actually raced mountain bikes earlier in my attending years. I still very much love riding my mountain bike. It's how I recharge my batteries. So you can always find me in the mountains, unless I'm on call, on the weekends, riding my mountain bike, spending times outdoors, getting into some kind of trouble. I just like to have a lot of fun. And I feel like I'm now finally comfortable to show up who I am and not care so much about what other people think or worry so much about what people think I should be doing. And that's been really liberating for me. And I like to say now that I'm the CEO of my life and I do the things that I want to do and that I enjoy doing and not what people think I should be doing. I say I don't fit in a mold anymore. I've basically said I am mold free. You can't fit me in a mold. I'm feeling pretty good about that.
Yeah, I love that. And that's what this channel is all about, right? What you're highlighting here is definitely something I invite people to explore in their own life I think sometimes people will hear your story and they think, great for her. I can't do that for blah, blah, blah reasons. And, our limiting beliefs or
Mhm.
scarcity model, and they get angry and they project things. However, there's an alternative, and, coaching comes up a lot. And so for people who may be interested in coaching, can you tell us a little bit more?
Yeah. So let me kind of address, your little earlier comments first. So a year ago, I had no idea what physician coaching was. And in about this time last year, I found my place in burnout. And I didn't really recognize exactly what was going on at the time. But one of the ways that I dealt with my burnout is through aimlessly scrolling through social media. And there was an oncology group that I'm part of that mentioned a physician coach. And I'm like, physician coach, what's that? But I knew I needed something because clearly I wasn't happy. I felt like I was failing myself, failing everyone else. I was exhausted. I didn't really see like changes. I had really just was feeling stuck. And so I started working with a physician coach. And I got to be honest, it was life changing for me. And I got to say, it's a process and you got to be open, because when people told me when I first started coaching, like, hey, this is your choice, you can decide, you can change your thoughts, you can, do X, Y, or Z. I was like, are you kidding me? No, I can't. Like, this is what I have to do. This is what my schedule is. This is what work tells me that I have to do.
Yeah.
And I really realized that that was really not true. Like, that's what my mind told me that I needed to do. And so, as I really transformed and grew and started learning about boundaries and people pleasing, and really started showing up authentically as myself and really feeling good about things, I decided like I've got to give this gift to other people. And so I got my coaching certification, and I now work with physicians who don't have it all figured out, is what I say. I would say some of my specialties include transition, both within clinical medicine and now without, and actually out of clinical medicine, and really helping try to figure out like, what does that look like? Because I feel like it is really changing your story and learning to walk with fear, because we've been a physician for very many years in a place that we are, and we're very comfortable. And as soon as we think about doing something new, our brain tells us like, oh no, you might fail. And, failure is a really scary thing, especially for people who have always been very high achieving, and we had to get into med school, and we had to get in, we had to get good grades and, compete for a residency and a fellowship and an attending physician. So failure is something that my brain has said, oh no, that's not an option. And then when I went into practicing medicine, failure is bad outcomes for patients. Patients could die. So any thought of failure was like, absolutely not. And to do something new, right? There's always a risk, especially in my brain, that says you could fail. And so I've had to really learn to walk with fear and realize that that's okay, and that it's actually growth. And so I really work with people, not patients. I'm so prone, to say patients, that it's
I
actually
say that all the
people.
time. Mm-hmm.
Yeah, not everyone's a patient. Got to retrain the brain here, multiple pathways. But people thinking about transition, looking at transition, just really trying to figure out like, how do they want to change their life? And another important aspect that I work with clients on is, again, identifying as more than just a physician. Like, we're so much more. And I feel like if we just identify as a physician, then if you have a bad day at work, then you kind of have a bad day, right? Like, you put so much emphasis on it. And the reality is that we're in a really tough time in medicine right now. And, I think the system is broken, and hopefully, we're going to change it and it's going to get better. But I think just putting your whole focus on I'm a physician when things aren't going well can be really hard to live the rest of your life. And so I think if you can just say, this is one piece of who I am, I think it can really be empowering to find other things that are important in your life. And it also gives you some distractions or other ways to stimulate your brain to have a passion that's just not medicine. And so I think it leads to being more well balanced, and overall, I think decreases your risk of burnout or helps you recover from burnout.
Yeah, and when I was thinking about the transition, and I know that you're going to coach people that, some sometimes the feedback with coaching is like, oh, well, everyone's leaving medicine. But coaching can actually, like when we think about transitioning, it can even be transitioning the mindset to exactly what you said is I'm going to transition the mindset. So I actually, my career, I say in medicine or whatever your career looks like, and you transition the mindset so that you can reduce your suffering within the career. And another feedback would be like, if we're so burnt out, I really wish I had coaching when I was trying to make the decision of leaving surgery or not. And a lot of people that come to me are people with that same question. And the same people that I think will come to you, or I'm thinking about leaving clinical medicine. And I really want people to know as a coach, it's like not really advocating for one or the other, it's really advocating for what's best for them and optimizing their circumstances. But what you said resonated so deeply because when I was thinking about leaving surgery, I thought that quitting was such a deep failure that that's where I wrote articles about my suicidal ideation. I rather would have died than leave. And so coaching, when it entered my life, it was another state of I was leaving another job. And this is just the power that I think that your ability to coach people during these questions of transition will have, because you get to walk with them. Because I will say from my own experience, like that's exactly when you need that coach, because your mind can really mess with you.
Yeah, I think that's absolutely right. And I hear so many successful, wonderful colleagues say, I'm failing. I'm failing at everything. I'm failing at a mom. I'm failing at a doctor. I'm so far behind in my chart. I'm not impressing, my boss. I'm not doing this. I'm not doing a protocol. And I think we're so good at pointing out our failures, right? And so I 100% agree that, although I say my specialty is coaching and transitions, it doesn't mean you have to leave. But I think when you're in that point where you're actually burnt out, or you're not happy, or you're feeling stuck, or you're feeling like you're a failure, you do need to transition something, right? And that can be transitioning boundaries. That can be looking at your schedule and saying, gosh, I don't really need to see 25 patients a day, right? Like, why are you actually seeing 25 patients a day? I don't actually need to say yes to every project that comes up, right? I don't need to do this because it's going to impress someone, but really learning to say yes to the things that you want to do and no to the things that don't make sense, or that you don't want to do, or that you don't have time to do, is so important. And by freeing yourself up, by either cutting back your schedule, by saying no to things that don't make sense, that just don't fit with you authentically, you bring more time, right? And that can be time to take care of yourself, time to work out, time to spend with your family. So absolutely, I think that very much it's a transition in your mindset, right? What I say is, you learn to become the CEO of your life, right? You come in and say, this is what I want my clinic to look like. This is how I want my, home life to look like. And you can get there. And again, if you would have asked me 12 months ago, is that possible? I'd have been like, are you kidding? Absolutely not. Like, this is what I signed up to do. This is what I have to do. But the reality is it's not. You can still be a very good doctor, a very good partner, a very good, you name it. But, when you come in with boundaries, and your yeses and your nos, you can make the picture look very different because you're actually deciding. And I think that's just super empowering. And I think the other thing we need to remember is, like, we are super successful people. If you decide you don't want to practice clinical medicine anymore, like, there's so many more options. If you decide you want to continue, there's options to change. I remember distinctly joking with some of my colleagues, in periods when we were just having a bad day, like, gosh, I'm a doctor. Like, if I wasn't a doctor, if I wasn't taking care of patients, like, what else could I do? And I distinctly remember joking around, like, well, I guess I could start coaching figure skating again. And I think, one of my colleagues said, like, maybe I can teach basketball at the YMCA. And I think that just illustrates that we so undervalue ourselves, and we don't trust ourselves, and we don't realize that, we can become successful in so many different ways. I think the hard part, but the empowering part, is just to figure out, like, what do you really want it to look like? And I think that's where coaching can really come in, is to help explore, what's working, what's not. Is this something I want to do, or is this something I'm doing because someone told me I should do it? So that's where I see the power.
Yeah, and there's so many. I'm like, oh yeah, so we should have a whole episode on boundaries, a whole episode on people pleasing, a whole episode on moral injuries.
Yeah.
Also wanted to share, I've never actually told this to the public, but I have told people that I worked for free because I didn't know my value. So I like couldn't advocate. And when I was at that state, I was desperate for income. So I applied for all entry level positions of like grocery stores and things like that, which are not below me at all. I had planned in my head, what would I do if I become homeless? And interestingly enough, I don't share that part of my story. I don't talk about that until just now because I've heard other people publicly say that they were applying to those same jobs, and that's fine, right? Like we're not above them, that.
Mhm.
But when it highlights exactly what you said, it's like, I have a dental degree and a medical degree. If I'm not practicing either, what do I do? And I feel so worthless. And it's like, where do we get that from? And so I know some resistance in our conversation will be going from that people pleasing mindset of like getting lost in the people pleasing. I think that's where we learn we lose our identity and we lose our own goals. And like, how
Mhm.
did you get from even starting to release some of the people pleasing and to start setting your boundaries so that you can have a better vision for what you want and go for it? Because I know a lot of the resistance is like fear, as you mentioned, of really exploring what do I want. And that fear can also come from like, I'm so lost, I don't know, and I have unworthiness, which needs to be explored at a deep level. But how did you, what did that look like in your journey so far?
Yeah, I'm going to say that that's definitely been a process. I feel like we are cultured to become people pleasers in medicine. And if you really think about, growing up and becoming a medical student, becoming a resident, becoming a fellow, becoming attending, like you always wanted to be the best, right? We're used to getting the best grades. We're used to, doing all the things that we needed to do to get into med school. And then once you're in med school, like you want your attending to like you. You want your attending to think that you're doing a good job. And so, what do? You walk into that rotation and you're like, okay, what does Dr. Smith want? Right? Like a lot of times I think you even talk to your colleagues, your friends, like, hey, you did that rotation with Dr. Smith. Like, what did he want? Did he want us to pre-round? What information did he want? How did he want us to go to the OR? Like, how did he want us to retract? How did he want us to cut the sutures? Right? Like, did he want us to present rounds? How did it do it? So, I mean, if you think back to med school, like you want to be seen as successful. And so you try to fit yourself into working with Dr. Smith. And then, the next rotation you go in and you work with, Dr. Long, right? And it's the same process. Like, how do I become what Dr. Long wants? And then you go into, as a resident, I think it's the same thing. And it's a fellow. And it's interesting, a couple months ago, I had this conversation with some of the third year fellows that are actually graduating. And I said to them, you're becoming an attending now. Like, what do you want your clinic to look like? And they're like, we get to make that decision. I'm like, yeah, you do. Like, you graduated, you kind of got your wings. It's time to fly. But my point is, we've done this for so many years that the next natural step is like, okay, I'm an attending. What do they want me to do? I don't know. Dr. Bradley, what do you want your schedule to look like? And you're like, I don't know. I think people pleasing is something that we learn and we get really, really good at. And we don't even realize we're doing it. And I just got to the point where I'm like, where's me? Who am I?
Thanks so much for tuning in today for this wonderful discussion with Dr. Debbie Bradley. Check the description box down below for information on how to contact her. Make sure to smash that subscribe button to be notified of when the next portion of this video drops. Thanks so much for being part of the community. We're glad you're here.